Hello, my name is Themos Dassopoulos. I'm a gastroenterologist at Baylor Scott White. I was born in Greece and after completing my education there, moved to the United States for my college and medical education. I liked gastroenterology because of the mixture of cognitive and interventional medicine. And then I liked inflammatory bowel disease because it really allows you to get involved with your patients, participate in long-term care. We know that inflammatory bowel disease is becoming more frequent in the United States as cases continue to be diagnosed and patients live longer, so that we estimate that by 2030 there may be 3 million Americans suffering from inflammatory bowel disease. On a different front, we know that a lot of patients have difficulties accessing care. It's dispiriting sometimes to see that patients who need certain medicines can't get them because they're uninsured, or patients who are even insured still having difficulty obtaining these medical therapies. So I hope we, along with the scientific progress, we see some progress at the societal level and political level and community level, and that's again where the Crohn's and Colitis Foundation plays a critical role in bringing together everyone. There is no question that management of IBD has to be integrated. Everyone is involved, everyone is a stakeholder, of course with the patient at the center. I listen to the patient carefully. I ask them, what is your greatest concern? What is your greatest fear? How can I help you today? And then we talk about the long-term management. We talk about the medicines, we talk about the psychosocial support, we talk about barriers to treatment, including transportation, finances, insurance. We explain to them that everyone has their own unique disease, and their participation, their active participation, is critical in best outcomes. I do that because that's the way it has to be.
Themos has had a great impact on our community here in Dallas. You have to remember that 20 years ago, we had about 3 different kinds of medicines we could use for treating IBD. And in the last 20 years, there have been literally dozens introduced and new ways of using those medicines to help patients get better. I think the biggest impact he's had, aside from the individual patients he deals with, is in setting the bar higher for IBD care in our community. I think the thing that I would say to him if I had that opportunity is thank you. He really came and made a difference to our program, what we can offer patients, and how we go about taking care of people. I think the thing that is most important is his integrity. When he tells you he's going to do something, he always comes through and delivers. If you don't have integrity, you don't have too much, and he has it in spades.
Dr. D has had a huge impact on my life, not only mine, but my family's. Everyone loves him. One of the things I always tell people when I refer friends, family, customers to him, because he's always the first name I think about when people have kind of the same issues, is that he's so kind-hearted and really cares. I mean, he just wants you to be better and have a better life. I can only imagine how many lives that he has made better just because of how he's helped me and my family deal with the disease. You meet a lot of different doctors and people when you're not feeling well, and he's just one of the most gracious and caring people that I know, and that's why I continue to go back to him.
From an advancement research perspective, I think he's done great things. He's always been a big researcher. He's always involved in clinical trials, and I think has dedicated his body of research to that, which is invaluable to patients, not just here in North Texas, but across the country. From a physician standpoint, he is always incredibly supportive. He spends as much time as needed. Having worked in healthcare for many years, not very many doctors are willing to do that and care enough to do those things. There's a lot of great doctors out there that simply just don't have the time to do that. And I am grateful that Dr. Dassopoulos is one of those who takes the time to share that information with his patients and is kind of there when they need him.
Being named the Physician of the Year is certainly a big honor. This is a recognition not of individuals, but of systems. We're all aiming to improve the care of inflammatory bowel disease. And I would say that in the DFW era, we're making progress in increasing collaboration between the institutions, increasing accessibility to care, performing more outreach, and I hope to see more of that in the future.
Themos, congratulations on getting the award for the CCFA this year. It is well deserved. You have made a tremendous impact to IBD care in our area, and I think that the community really applauds you for your efforts in this regard.
Dr. Dassopoulos, thank you so much for your tireless efforts over the last 10 years in caring for me and caring for countless other patients. You make a difference in every single one of your patients' lives on a daily basis, and we are so grateful.
Thank you, Dr. D, for all you've done for myself and my family, and you definitely deserve this award. Congratulations, and I love you.